Acral lentiginous melanoma. Definition: Acral lentiginous melanoma is a kind of lentiginous skin melanoma. Melanoma is a serious skin cancer that derives from the pigment cells melanocytes. Although acral lentiginous melanoma is rare in people with lighter skin types, it is the most common subtype in people with dark skins. Acral lentiginous melanoma is observed on the palms, soles, under the nails, and in the oral mucosa.
Acral lentiginous melanoma. Acral lentiginous melanoma accounts for 7% of all melanomas. Acral lentiginous melanoma is more common in males than females and usually in older people. It occurs primarily on the hands and feet, including the skin surrounding the nails of people with darker skin types 4 through 6. Similar lesions also occur on the modified skin around the mouth, anus, and genitalia. Acral lentiginous melanoma is the most common form of melanoma in the skin of Asian and Black people, accounting for more than half of melanomas in these groups. It is the least common form of melanoma in Caucasian people. Other than location, the lesion is similar in appearance to lentigo maligna and lentigo maligna melanoma, appearing as a flat, slowly expanding pigmented macule with a fairly uniform mottled color. It appears and evolves over years. The sudden appearance of a pigmented band originating at the proximal nail fold or pigmentation in the proximal or distal nail fold is called Hutchinson's sign and is suggestive of acral lentiginous melanoma.
Acral, referring to the peripheral parts of body, toes, fingers, etc. Lentiginous, pigmented spot of the skin, melanoma, is a tumor of malignant forming cells.
In this video you'll find different types of skin cancer pictures. One of the best ways to detect skin cancer early, and to prevent the spread of the cancer, is to take early skin cancer pictures and show them to a doctor. Actinic keratosis, also called solar keratosis and senile keratosis, is a precancerous patch of thick, scaly, or crusty skin. These growths are more common in fair-skinned people, and those who are frequently in the sun. Actinic keratosis is considered to be potentially precancerous. If it is left untreated, it may turn into a type of cancer called squamous cell carcinoma. Basal cell carcinoma, also known as basalioma, or basal cell cancer, is the most common skin cancer, and one of the most common cancers in the United States. While basal cell carcinoma has a very low metastatic risk, this tumor can cause significant disfigurement by invading surrounding tissues. Squamous cell carcinoma of the skin is a common form of skin cancer that develops in the squamous cells that make up the middle and outer layer of the skin. Squamous cell carcinoma of the skin is usually not life-threatening, though it can be aggressive in some cases. Untreated, squamous cell carcinoma of the skin can grow large, or spread to other parts of your body, causing serious complications. Melanoma, also known as malignant melanoma, is a type of cancer that develops from the pigment-containing cells. Melanomas typically occur in the skin, but may rarely occur in the mouth, intestines, or eye. Sometimes they develop from moles with concerning changes, including an increase in size, irregular edges, change in color, itchiness, or skin breakdown. Unfortunately, conventional doctors don't tell you the truth about skin cancer. They don't tell you that there is a natural solution for skin cancer prevention.
Application in medicine. A doctor may use an instrument called dermatoscope to get a closer look at the growth. If the physical exam raises concern that there might be cancer, next step is usually a biopsy. A biopsy uses a needle to remove a small sample from the tumor.
Hi, my name is Ken, and today I'll be talking about the importance of dermatoscopy in the diagnosis of the most deadly form of skin cancer, melanoma. Dermatoscopy, also known as dermoscopy, is the examination of the skin using special devices called dermatoscopes. These come in a variety of size, shape, and form, and the most widely used dermatoscopes nowadays are battery-powered handheld devices similar to this. All dermatoscopes have two important components. First, a high-quality magnifying lens that enlarges the skin by over 10 times its original size. And second, a unique polarizing lighting system that reduces reflection of light from the top layer of the skin. What this means is that a dermatoscope gives us not only a larger, clearer picture of the skin, but also shows us structures in the deeper layers of the skin that we can't see with the naked eye. The dermatoscope is an indispensable tool used by dermatologists to diagnose a wide range of skin conditions. However, the most important use of dermatoscopy today is to improve the detection of melanoma. Because the dermatoscope allows us to see into the deeper layers of the skin, it can reveal unique structures that tell us whether or not the mole we're looking at is a melanoma. These dermatoscopy signs can be seen early, even in very small melanomas, before the classic A, B, C of melanoma develops. This makes sure we diagnose melanomas early, and that we don't miss any small melanomas that might otherwise look harmless. In fact, research has shown that dermatoscopy is up to 35% more accurate than using the naked eye. This is important because it means that the dermatoscope not only helps us to diagnose melanomas earlier and more accurately, but it also reduces the number of unnecessary surgeries that we perform to remove moles that we could mistaken with our naked eye as being a melanoma.
Pros and cons. Cons. Acral Lentiginous melanoma staging looks at the three factors. Tumor. Number range from 0 to 4 and denote the size of a tumor. Note: these indicate whether lymph nodes have been affected, and the scale range from 0 to 3. Metastasis. Metastasis is the spread of the cancer from one area of the body to another. No pros.
Think you found every hazard out here today? Think again. The spot you missed could be a killer.
The American Academy of Dermatology wants to put an end to an alarming statistic.
In the last 10 years, every year the number of melanomas have increased by about 9% in men over 65. It's a serious epidemic.
Dr. Rutledge Forney says older Caucasian men are at a very high risk, but anyone can be affected.
If we catch a melanoma early, 99% of them are curable. If we don't catch it until it's advanced, then 85% of people will die from melanoma.
To watch for signs, remember A, B, C, D, E.
The first one is asymmetry. If you can take a lesion and cut it in half and the two sides don't match, that's a warning sign. The second is irregular borders. Two colors is one of the main things we look for. The fourth thing is the D, which is diameter. We know that moles that are bigger than the size of a pencil eraser have a greater risk factor. And the last is E for evolving or changing.
Dermatologists recommend men over 40 who are Caucasian, have a history of sunburn, or who have fair skin or numerous moles get an annual skin check. Family history also raises the risk for melanoma. For today's Health Minute, I'm Susan Hendricks.
Issue applied in Ecuador. Acral lentiginous melanoma is located in the palms and the sublingual regions, and it is the etiology that presents of mutation in several genes have been described: 9p21, p16, 67%, 11q13, ccnd1, 47%, 22q11, q13, 40%, and 5p15, 20%.
We're discussing a rare form of melanoma in Hawaii, and doing that to join us is Dr. Shane Morita. He is a surgical oncologist from the Queens Cancer Center at the University of Hawaii. Aloha. Thanks for being with us. So this is some pretty interesting work that you're doing. Please tell us about your poster.
Sure, it's on acral lentiginous melanoma in Hawaii, looking at a non-Caucasian population, as well as a unique, somewhat novel pathway called the mTOR signaling cascade.
Now, this is a form of melanoma which has nothing to do with sun exposure.
Right, this type of melanoma, which Bob Marley died of in 1981, is felt to not have any pathogenesis related to sun exposure.
What does it have to do with?
You know, genes, I think people are trying to elucidate this a little bit further, but genes are probably involved, and inflammation, trauma.
How did you design this study?
Well, being in Hawaii, we have a multi-ethnic population, and as this type of melanoma tends to be seen in non-Caucasians, we felt that we had a unique access to this type of tumor, and we looked at this pathway that is getting a lot of attention, called mTOR.
And what were the results you achieved?
We found that the mTOR pathway was seen in over 50% of these patients with acral lentiginous melanoma, and in the future, this potentially can help in designing therapeutic trials.
Where would you go in the future with this?
Well, in addition to therapy, for example, now with melanoma and the targeted therapy, perhaps using this, looking at these targets, see if they exist prior to giving someone the type of therapy such as mTOR-related therapy.
This is the first study of its kind on this topic. What type of feedback have you gotten?
So far, I had a lot of interest in discussions because, again, we have a unique population being in Hawaii, multi-ethnic. It's never been done for in the non-Caucasian population, and this pathway needs to be studied more.
Dr. Morita, best of luck as you continue this area of research.
Thank you very much.
Conclusion. Population data showed that the acral lentiginous melanoma is a rare melanoma subtype, although its proportion among all melanoma is higher in people of color, and it's associated with a worse prognosis than cutaneous malignant melanoma overall. Thank you.